Welcome to the RecoverMe podcast with Warren Willey, doctor of osteopathic medicine, a best-selling author, and leading expert on holistic, healthy living. Warren is your guide to living a naturally healthier, happier life. So much of Western medicine, popular diets, and fitness fads put a bandage over health problems, addressing symptoms and not causes, offering short-term results at the expense of long-term health. That's why Warren is a man on a mission to question the status quo and uncover holistic health solutions you can use in your life, starting right now. Now to get us started today, here's Warren.
Well, welcome back to the RecoverMe podcast, the medicine that meets you where you are. Today we have, once again, that very distinguished colleague of mine, Randy Vawdrey, nurse practitioner extraordinaire, NPE as you recall, not NPC. He is going to talk to us today, or talk with me today, to you about dementia. Now, Randy has been working in a number of assisted living facilities in Arizona, in Idaho, has his own practice, is just growing like crazy, helping people understand their cognitive health and optimizing it. We've always been taught, I was taught in medical school a long time ago, Randy was taught in NP school and in nursing school prior to that, boy, dementia, nothing you can do. Shake their hands, keep them sedated so they don't hurt themselves or others, and wait for them to pass. That's literally the best medicine we have right prior to what Randy's doing. That was a treatment of Alzheimer's disease and other forms of dementia. That's totally changing. We're seeing that the brain's very elastic. In other words, it can change, and it has an amazing degree of ability to change. And I think the future in dementia, cognitive dysfunction, traumatic brain injury, even mild memory loss that we all seem to deal with once in a while is going to drastically change with some of the stuff he's doing. So I asked him to come back on our podcast today and discuss dementia. How are you doing, Randy?
Awesome. Thanks for having me. I'm glad to be back.
Yeah, thank you so much. This is so fun. Now, and just to warn everybody, Randy and I have been colleagues and good friends for 15 years now. And so we might have some inside jokes that I'll just wink at him at. No, I'll try to keep those to ourselves. But yeah, we've been working together for a long time, and our style of medicine really jives. Randy's primary goal is just like mine, help people live a better quality of life. And do it as cheap as possible, do it as easy as possible, and don't just do things to cover or bandage symptoms. Let's get people better, because all we do in Western medicine is when we bandage symptoms is just wait for them to return. It's a great business model in our capitalist system, but I don't think it's what's best for people. So that being said, Randy, I'm going to dive right in. Tell me about all the different kinds of dementia, if you would.
Well, that's a really good question, because dementia is a categorical term, kind of like arthritis, right? When someone has arthritis, sometimes we differentiate degenerative disc disease or rheumatoid arthritis or osteoarthritis. There's different types of arthritis. In dementia, there's several different kinds of dementia. So Parkinson's and frontotemporal lobe dementias, vascular dementias from stroke, and Alzheimer's disease. And a lot of the research is now suggesting that within the Alzheimer's category, that category that has amyloid beta that builds up in the brain or tau tangles, that there are other variations of Alzheimer's disease that are not created equal, and the approach to treating them are also not the same.
I think that's, if I may interrupt you, that's part of the issue, is understanding that alone. And part of because I remember back in the early 90s when I was in medical school, Alzheimer's was caused by these tau plaques, period. And that's all there was to it. There's nothing you can do about it. Sorry, we don't even know how they form. Shake your hands, goodbye.
Exactly. And I think that's where the explosion of data is coming from. For years, that was the theory, that when you get this amyloid plaque or this tau protein, it was the cause of Alzheimer's disease, right? And historically, you couldn't even diagnose it until someone dies and you do an autopsy.
Right.
But they would manifest these symptoms or characteristics that were very similar amongst the spectrum of of Alzheimer's, which that's an interesting thing. Maybe we should call Alzheimer's a spectrum disorder, just like we call autism a spectrum disorder, from very severe and different types and characteristics. That just came to me as we were talking about that. But
that's good.
But really, we've now learned that amyloid protein and tau proteins are manifestations of the disease, but probably not the cause of the disease. And that's a really interesting way to think, because if you're going to get to the root cause, Dr. Willey, you are the king of asking, well, what's the root cause of this? Why does the person have the symptoms instead of just putting a Band-Aid on the symptom or giving a medicine for the symptom? If that applies to Alzheimer's disease, then we have to go dig a little deeper and say, okay, it's not just that they have these amyloid beta plaques or these tau proteins. Why do they have them? What has caused the brain to develop these tangles and then led to the symptoms that we're seeing? And when a healthcare provider really dials in on that, it changes the perspective of how you're going to treat.
Oh, absolutely. Well, it's just like infection. You can say, I have an infection. Well, do you have a virus infection? And if so, which virus? Rotavirus, norovirus, influenza, herpes. I have bacterial infections, fungal infections. You're right. We do that with other things, but we don't do that when it comes to the brain.
Yeah, and when you have that infection, do you ever think to yourself, how am I going to get rid of my white blood cells? How do I eliminate my immune system? Because my immune system has gone crazy and my white blood cell count has gone crazy with this infection. So for the treatment, do you really want to obliterate your white blood cell count? And naturally, the answer is no way. We don't want to do that. Well, that's what happens in Alzheimer's disease. Think of an amyloid plaque like you would think of a white blood cell in the brain. And if you go in to destroy that amyloid plaque or get rid of it, maybe you're just getting rid of the manifestation of the disease, because the new prevailing perspective is that amyloid plaque is a protective mechanism that your brain has developed in response to an insult. And so we'd be so much better off to sort out why did that amyloid plaque form, and eliminate that as the cause and allow the body to get rid of the amyloid plaque, let that settle down. Just like your white blood cell count goes down when your infection is resolved.
So interesting. I mean, you made me think of the analogy of tuberculosis. Tuberculosis is a bug our body has a hard time getting rid of. So what does it do? It walls it off. It's called a granuloma. And that's how we diagnose it on x-ray, is you see these granulomas in the upper lung and the apices of the lungs, and you have to think tuberculosis. So what you're saying is something's going wrong in the noggin, and the body's response is these beta amyloid plaques. And so just like we know the cause of the granulomas in the lung is tuberculosis, we need to look for the cause of the amyloid plaques in the brain.
Yes, exactly. And that's a really good example that for a long time we've gone after the wrong problem. Mm-hmm. And is it any wonder that there's been 244 drug trials in the last 20 years and they all have failed? Right? I mean, we've gotten two classes of drugs that are indicated for the treatment of Alzheimer's disease. And you and I both know we've prescribed those 100 times, thousands of times, and they really don't make a significant difference.
Only to your wallet.
Exactly. So that's a really good analogy with tuberculosis. And so most of my work has been designed at really drilling down and figuring out, okay, we think you've got these amyloid plaques, and there are some now diagnostic tests that you can do to identify those plaques. But more importantly, let's try to figure out why you got those, and let's sort through that together. So that has been a really exciting work. I think it gives people hope. And the amazing thing is, just like the immune system, when you get rid of the insult, your body can get rid of the plaque.
Right.
Your body has natural mechanisms to clear those amyloid beta plaques. And that's also new. We didn't know that you could do that. So it's a fascinating, it's an exciting time to be an Alzheimer's researcher and practitioner.
That's so cool. So new, you mentioned new. There is a ton of new research coming out that's starting to, what you've known for years, focus on. Tell our listening audience some of the new research in Alzheimer's? Because I guarantee, and you know this as well as I, every single person listening, no matter what age, no matter what their demographics, where they live, knows someone with dementia
Yeah.
or is affected personally on a personal level by cognitive disorders.
Yes, exactly. So one of the first big trials that came out was called the FINGER trial. The FINGER trial it's kind of an acronym for a Finnish geriatric trial. And it was the first big trial that was double-blinded, right? In traditional medicine, we want to make sure we have control groups and our kind of experimental hypothesis group. And we also want to look at multiple interventions of how they respond to treatment. So this study was printed originally in The Lancet in 2015. So now we're going on 3 years. This study had 2,650 people in it, and they followed these people for 2 years.
It's pretty good power.
Yeah, that's a significant study, right? It for the first time, we now have a study that showed you can prevent Alzheimer's disease with very specific interventions in a relatively large study size. And we haven't had that for a while.
No.
And the difference between this study and all the traditional studies is we weren't testing for a drug. We were testing for doing things like if you lowered the cardiovascular risk and you changed the people's diet and you helped them with certain exercises and you did some brain training and you encouraged socialization like in these group settings, what would happen to these people? And very statistically significant, it showed that the group that was involved in modifying those risk factors, and I'll go back to our previous discussion, the group that was involved in trying to modify the reason you would develop an amyloid plaque or a tau protein, a tau tangle, this group showed significantly less onset of Alzheimer's dementia or the symptoms of Alzheimer's disease. And it was the first time that we sat back and thought, oh my goodness, this isn't just a genetic problem. If you're born with the genes, you're in big trouble. You're going to get Alzheimer's. This study looked at all different groups of people of ages between 60 and 77 years old and followed them for a period of time, and their onset of Alzheimer's disease was significantly less when we managed the reasons they might develop amyloid plaque.
Oh, that's so fascinating. We talk a lot in RecoverMe medicine about the effect of epigenetics above the genetics. And I've used the examples in a couple of podcasts, and you've read this before, and I say this, and you say it too. We do a lot of ApoE testing, which is the gene for Alzheimer's. And when people have a 3-4 or 4-4 allele typing, they are at higher risk, much higher risk than someone with a normal or more common allele typing 3-3. But I have people in my practice that are in their 80s, early 90s with the 3-4 genotype who are sharper than I am. On the same sense, I have people in their 40s and 50s with the 3-3 non-Alzheimer's disease type with heart attacks, post-cabbage, and brain issues. And so what you're saying and what this study showed that, yeah, your genetics may be this, but there's still an influence from your environment. Yeah. And that makes genetics more like a light switch on a dimmer versus, oh crap, mom gave me the Alzheimer's gene, I'm screwed.
Yeah, the statement that I always hear at medical conferences, your genetics load the gun, but your environment decides whether or not you pull the trigger.
I like that.
So individuals who have, like I might be born with the gene that for lung cancer or liver cancer, but if I don't smoke and I don't drink and I take care of myself, I'm likely never going to turn those genes on. They're not going to be expressed, right? So the way that we live our life becomes the determinant of whether or not that gene becomes expressed. And Dr. Bredesen, who is, I think that he's a Nobel Prize winner when it comes to Alzheimer's. And, no one really recognizes who you have around you until it's down the road and you look at what kind of legacy they left. Mm-hmm. But Dr. Bredesen teaches that your genetics convey some element of susceptibility to the disease, but they're not determinative.
Right.
And so I met with a gal just yesterday in my practice, and we talked about that because she had one Alzheimer's gene and she was worried about it. And I made sure that through the course of our discussion, look, you are not stuck with the brain that you feel like that you're bound to have because of your genes. You can make a difference. You can change these variables. And so we talked about 6 or 7 variables that for her were very important at minimizing the risk.
Oh man, I get so fired up thinking the way I was trained, how you're just doomed to this. And our society is absolutely convinced you are doomed to it. But by the way, I mean, look at me, I'm a great example right here on the video. I have the genetics for hair like Fabio, but my environment, because I'm a high stress type A, it all fell out. So that just shows once again the power of the environment. I should have long, flowing, blonde, beautiful hair like Fabio. Now only us old guys will know who Fabio is.
I know who Fabio is.
Yeah. Yeah, exactly right. So that finger study is incredible. I love that. And we've talked about the genetics. Tell me about the approach to Alzheimer's. Well, let me back up a little. Western medicine's approach to any disease tends to be very rifled. And what I mean by that, it's very direct. You have strep, penicillin, right? And that goes on and on. You have high cholesterol, statins. The Alzheimer's approach has been, you have Alzheimer's, that sucks.
Yes, exactly.
Talk to me about the pragmatic or the bigger approach to Alzheimer's and why it's important not to shot or rifle it, but you may want to come at it more with a shotgun, if you will, really spread out and look at everything.
Yes, exactly. So we've just been conditioned in conventional medicine that we get really good at diagnostics and we diagnose a condition. So we gather history and we do a good physical exam and we do a bunch of lab work and we do some imaging studies. And then we say, okay, we are sure that you have this disease and so you should take this pill. Mm-hmm. And in some regards, we think it's a silver bullet for the condition. And that works really, really well when you have strep throat or when you have cellulitis. When you have an infection where we can identify this bug is susceptible to this antibiotic, take it and the disease goes away. But we've kind of been hypnotized by that style of medicine. So that becomes the approach for all illnesses. And the truth is that only really works in acute disease. So you get sick over the weekend and you get an infection, then you take this medicine and you're better. In all of the chronic diseases where there's so many contributing factors, you have to have not a silver bullet, but maybe silver buckshot. And Dr. Bredesen compared this to if you had a house that had 36 holes in the roof, you need to plug all of the holes in the roof if you want to make a difference. You can't just plug one hole and say, oh, I did it. I took that medicine and it's better now, right? That doesn't work. You have to identify what are all of the variables and then correct for that. So I'm going to give you an example from just my private practice when it comes to weight loss. When I sit with individuals and I say, we want to help you lose weight, which one of these interventions would you like to do? Would you like to adjust your diet? Would you like to just do push-ups? Would you like to take a medicine? Would you like to sleep a little bit better at night? Would you like to add more fiber to your diet? Which one of those, pick which one of those you want to do, and that's how we're going to help you lose weight. And most people will kind of crinkle their forehead and say, well, do you think we should do like a little of all of that? And that's the same with Alzheimer's disease. In weight loss, you don't just pick one thing you're going to do. You set up a program. So you say, okay, I'm going to exercise on these days, and some days I might do cardio, and sometimes I might do resistance training or HIIT training. And then I'm going to shift my diet. And we all know that the kiss of death to dieting is monotony. If you just eat chicken and broccoli every day, you're going to not be able to follow this program. But if you can mix it up and do a program over time, higher carb and lower carb, and then you really focused on your recovery. I mean, Dr. Willey, you are the master of that. Weight loss is not just about how hard you exercise, it's about how hard you recover after a hard exercise routine, right? So that's a programmed response. The example is exactly the same in Alzheimer's disease. If we want to cure Alzheimer's, you can't just pick one intervention like a medicine or one intervention, I'm going to sleep better and my Alzheimer's is going to go away. You program a bunch of interventions to get better.
Oh boy, you nailed it. Nailed it. I love that. I've always wondered, and I just thought of this because you said silver bullet a couple times, and we just got done with Halloween this week. I always wondered in the horror movies why they would only shoot the werewolf with the silver bullet. Why didn't somebody walk up and chop its head off?
Because it was a zombie.
I guess so. Maybe it just puts it back on and keeps coming after him, or I don't know. But it's the same thing. It's not just a silver bullet. There's so many ways to kill the werewolf or treat the Alzheimer's disease. Tell me about. I know you have all this stuff. It's so fascinating. But go through. Let's see, like dietary, infectious, inflammatory, toxins. Give me kind of a list of those things that are the cause, the underlying root of Alzheimer's. Now, we know not one of them plays any more important role than the other, but list those out for me. When you do an intervention in a nursing home with or a private patient, tell me all the things you guys cover.
Yeah, that's a good question. And this could be a discussion just all of its own, because
each one of these points, I'm sure.
Yeah, it can become really complex. So when I first started doing this, everyone just did the exact same lab work, right? So here's this litany of tests that I want you to do. And sometimes I still think there's great value in doing that, because oftentimes someone's traveling in from out of town. I have a lot of people that will come to sleepy little Idaho for a consultation, and I don't know anything about them, and I've only got 1 hour with them, and then they're going to drive 5 hours south again. So there are instances where I just do a great big panel of tests. But to your question, that panel looks at things like inflammatory markers. And let me back up real quick. It's not uncommon that patients will say, oh, my doctor already did all of the blood tests. So they already checked all of those and they didn't find anything. And I have to be thoughtful, because I would respond just like you. I'd kind of sit back and go, yeah, whatever, right? Because things like omega-6 to omega-3 ratios look at how healthy is our body in terms of the quantity of fat that's available. And we live in a society where medicine has just hammered people about their cholesterol levels. And in fact, I talked to a nurse practitioner on Monday of this week that says she sent a patient to a cardiologist, and the cardiologist said, my goal is people's LDL needs to be less than 30. And I about had a panic attack, because I thought, are you kidding me? There is a threshold of fat content that your brain has to have to even produce a neurotransmitter, right? They are fat soluble, and when we pass something across the synaptic membrane, it's done through a fat carrier. And so if you just bottom out your cholesterol, you're toast. You're going to be depressed and nothing's going to work. So I don't want to get side-railed on individual things, but my point is that when people say, oh, my doctor's checked everything, I often think, well, we better look at that, because what they're saying is my doctor looked at cholesterol, which he or she tried to lower, and I don't want it so stinking low. And then they looked at your blood sugar and your metabolic panel and your blood counts and a TSH and maybe an A1C, and that's about it. But a really comprehensive panel would look at inflammatory markers like a CRP. Sometimes I've done interleukins and tumor necrosis factor alphas. I've started doing more and more omega-3 to omega-6 ratios. We look at all of the metabolic panels that look at things where you might be at risk for diabetes or specifically insulin resistance, because a lot of people are not necessarily diabetic yet. I mean, it depends on how you quantify whether or not they're diabetics, because that too is a spectrum disorder, right? Would you not agree? Just like autism, there's a spectrum disorder of diabetes that starts with very healthy metabolism to you need insulin every day just to exist. And there's this whole range in between of how insulin sensitive you are.
Yep.
A really good thorough testing is going to look at metals, specifically copper and zinc levels. And depending on the person's history of exposure and employment, or whether or not they've been a smoker, or where they've lived in the world, if there's a lot of pollution, we look for things like mercury and arsenic and cadmium. A really good metabolic test is going to look at how the thyroid works just beyond a TSH. And Dr. Willey, you know as well as I do how many people have an element of Hashimoto's where their TSH is probably on the sluggish side of normal, but then they have these antibodies, thyroid globulin antibodies and TPO, and these antibodies tell us that there is an insult already happening in the thyroid, and if that insult's happening in the connective tissue in the thyroid, where else is this happening? So autoimmune diseases, and we look at head traumas, people who may have had post-concussive syndrome, where, you know how many times I've asked people, have you ever had a concussion? Nope. Say, okay, and so you've never fallen and hit in your head? Nope. And you haven't been hit in sports? You haven't been knocked out? Nope. And so you've never been in a car accident? Oh, wait. Yeah, I have been in a car accident. And and in that car accident, did you hit your head? Well, I did break the windshield. Right? And you think to yourself, that's concussive. And so when we look at concussions, we look at the immediate injury, but post-concussive syndrome can just go on in perpetuity if we don't change the way that the brain works. So I hope I didn't get sidetracked in answering your question, but the point is that you have to really be thoughtful about looking at all of the things that stimulate amyloid beta and address those items. And if you...
go ahead. I'm sorry. I was just going to say one thing you touched on, which I like to emphasize in the RecoverMe basis of medicine, and that is you can't use normal limits either. And when you're doing lab work, you really have to look at the forest through the trees. You have to see, okay, TSH is normal by this lab, but TPO is high, and their free T3, their active thyroid hormones, on the low side. It's 2, where it should be between 3.5 and 4. And yeah, now it's normal, but boy, we've got to optimize that. And that's part of the RecoverMe medicine process, is optimizing everything, not just bringing you back to normal. Lipids, great example. Yeah, okay, this cardiologist wants LDL below 30, but remember, all the sex hormones, glucocorticoids, and mineralocorticoids stem from cholesterol.
Yeah.
Right? And so, as you well know as well as anybody, that includes the neurocognitive hormones, DHEA, pregnenolone, progesterone. And so just looking at a lab or just treating a normal value is really a setup for failure. Yes. And so someone like you, when you do all these labs and somebody walks out after having 17 tubes taken, they can barely walk straight because of the blood loss. Just kidding. But really, you have to interpret them from the umbrella viewpoint, the whole thing. How does this relate to this and this? And then how does that, what I'm seeing here, relate to my patient's history and their background?
So Dr. Teitelbaum is kind of a functional medicine doctor, and he gave an analogy one time I loved in some dementia research, and he said, let's say that the normal size of a shoe is between a 6 and a 12, and that's considered a normal shoe size in our environment. Well, let's say that you lost your shoes, and so you come over to my house and ask my wife, hey, I lost my shoes, I need to borrow a pair of your shoes. And my wife says, perfect, I wear a size 8, these are normal, here. And she hands you a size 8 shoe. That doesn't fit you. No. Right? So that might be normal from the context of the whole population, but it's not normal for you. Right. And if you go back to our previous discussion about thinking of silver buckshot and not silver bullets, if you have 10 values in your lab work that all fall within normal limits, but they're all on the crummy side of normal. So your thyroid is on the normal side of sluggish, and your insulin is on the normal side of insulin resistance, right? And your testosterone is on the normal side of low. And your inflammatory markers are on the normal side of elevated. And your pregnenolone is on the normal side of very low, and DHEA is very low. And you start looking at that, all of these things add up in their aggregate. And so what if we took all 10 of those measures and pushed them to the optimal side of normal? So instead of being your sluggish thyroid, you're on the optimal side of thyroid. I don't know about you, but I don't ever want my thyroid to be sluggishly normal.
No.
That's lame, right? And from a geriatric, and I should say a senior population, how many seniors do you know that in the middle of the summertime are sitting on a couch with a throw blanket because they're cold?
Yep.
And then they say they're constipated, right? Well, really, do you think that having a sluggish, normal thyroid and being cold in the middle of the summer and you can't poop but every 3 days is normal? You have to take those things into consideration. So I think that's the magic of thinking, like you said, of what is optimal and thinking of buckshot, not silver bullets. And I could bore you with stories of people who have done better when all you do is optimize the values that every other practitioner said were normal.
Oh, me too. We could have a 70-hour podcast on that very topic, just pulling case studies up. Absolutely amazing.
Yeah, can I give you a quick example of one of these?
Yeah. Oh, please.
I have a senior whose family back in June moved him into an assisted living center. Assisted living centers are graded between you don't need very much assistance to you need a lot of assistance to, oh my goodness, you need us to do everything. That's called memory care. Well, he was just needing enough assistance that his children didn't feel like he was safe at home anymore. So they moved him into an assisted living center with a relatively low level of care. So he gets up, he gets himself dressed, he knows where the cafeteria is, he makes it down, he participates in activities, blah, blah, blah. They came to us and said, could you help put together your enhanced protocol and see if we could do some things that would prevent him from declining further? I received notification last week that his family is taking him home at the end of the year. That when we optimize all of these variables, he has done so well that his family says, I don't see the need to pay $4,000 a month to live in this community. All of the problems that brought him to the community have resolved. So we're going to take him home. And that was that, even though I know this works intuitively, and I have worked with a lot of individuals, probably now 250 individuals. That has been my first experience of someone who deteriorated to the point they had to go to an assisted living center and within 6 months returned to an independent living because they're doing better. I mean, how amazing is that?
Oh my gosh, think of the implications. One, with our aging population. Two, with the cost of healthcare. And like you said, $4,000 a day. If the family doesn't lose their house trying to pay for mom or dad, the government, we will, in taxes. It's just the implications of that are so huge.
It was mind-blowing.
I can't, I'm dumbfounded. That's kind of, I love the term, and I wanted to bring that up during this podcast, cognoscopy. I love that term. That's basically what you did with this gentleman. Tell me about that.
Yeah, so everyone is accustomed to preventive screenings. So everyone gets a colonoscopy and they get their cholesterol checked, and women get mammograms and pap smears, and we check our blood sugar at health fairs. I mean, we have just been drilled into us preventive medicine. But one element of preventive medicine that has been completely missed is the element of doing tests to check the brain. That's right. Yep. And Dr. Bredesen coined the term, get a cognoscopy. And I love that term. Everyone knows what that would mean, just hearing the term. It's basically that you better figure out all the variables that are going to affect your brain health, and you should start early. There's no reason people should wait until they have memory problems and get lost driving their car before they have their first cognoscopy. That should be happening to people when they're 45 or 50 years old. And if you have a mother or a father out there that died of the ravages of Alzheimer's disease, then you need to start now. You need to start before there's any problem whatsoever.
Yep.
And you do that cognoscopy, which basically means you do this litany of tests and you find out where you fall outside of the optimal parameters and you correct for those. And in the hundreds of patients that I've worked with, I have yet to have one patient that came back and didn't say to me, I feel better. Every one of them says, wow, you identified these things. I have a corporate executive that works for a very large publicly traded company, and this individual is at the top of the realm. When I did a memory test, 30 out of 30. He's doing wonderful. But his wife drug him down to the office because she says, you know what? He's just not as crisp as he used to be. And he's kind of irritated with his wife. We've all been down that road, right? My husband needs help, and you think, oh, please.
I never irritate my wife personally.
Yeah, good answer. When I went through and did the questions, he had no deficits. So it's interesting that his wife sees he's not as crisp. And the way I explained it to him is, look, let's say that the average person has this much memory function, and you have this much memory function. You have this much more than the average. You could lose this much function and nobody would know.
Yep.
Because you have that much more capacity, right? He's a very high IQ. He's very organized. He's very methodical. And so I said, the challenge is that this gross testing that I do in my office, this just simple questions, you pass it like that. So you could walk out of here and say, yeah, I'm fine. But the truth is, if you have that much more capacity than the average person and you've lost a little bit, no one would know. We call that cognitive reserve. And so after that visit, it dawned on him, you know, I need to do this. And so we did the cognoscopy of tests. I sent him the summary of information that he needs to do. I write up a big summary and sent it to him. He came back about 3 months later. He was down 20 pounds. And he straight up, the first thing he said is, if I didn't know this before we started, I wouldn't have believed it, but I'm sharper. I'm doing better. And
incredible.
Yeah, it was awesome. And so, and the challenge is his father just passed away from complications of diabetes. And he very much had an insulin resistant picture. So he himself was not diabetic, but he's gaining weight around the waist. He wasn't as physically active. His fasting insulin level was a little bit high. And even though his A1C was normal, it's starting to creep up there. So by just doing the cognoscopy now, before there's a problem, he was able to come back and say, I'm doing better. I like this.
Oh, that is so incredible. I love that cognitive reserve thinking, because it's true. And our loved ones are so wise. And I encourage people all the time to bring your spouse, bring your loved one, bring someone in who's with you so they can be part of it, because we never see that in ourselves. He didn't see it.
And you know, Dr. Willey, this is, I'm so glad that we're doing this webinar, because traditionally people, I think, have wanted to come in and talk to a doctor about this, but they don't, because their perspective is there's nothing you can do about it anyway. Why am I going to go have the doctor say, you're screwed, man. You've got early onset Alzheimer's disease. Get your affairs in order, because this could go quick or this could go slow. And so, you know, I chuckle. In the research institutions, they say, oh, I think this is Alzheimer's, but I want to see you every 6 months so you can get an MRI and a PET scan, and I can do neuropsych testing, and then I can reassure I get my grant again next year, right, for my research, but I really don't have anything for you. I think that's why people haven't come historically to do a cognoscopy. And so we need to preach from the rooftops, everyone that's out there, to know not only should you go get checked, but you should get checked because there's something that can be done now, and we didn't realize that 10 years ago. Oh,
exactly. I think I said this on our last podcast on memory. We talked about how preventative medicine, throughout a woman's lifetime, she'll have 40 pap smears and 40 mammograms and not one exam on her brain.
Yeah.
What? And men, yeah, you start getting prostate exams at age 50. Well, leave that for the government. They do it every April 15th. I would say we need to focus on the brain, because you hit it on the head. There is something we can do. I hear all the time, and you do too, patients bring me their lab from their doctor because they're very unsatisfied. They said, I know something's wrong. My doctor did all this lab work and a physical on me, and he says I'm fine. It's all in my head. It's all in my head. Well, it might be your brain. So let's look at it. Let's do a cognoscopy on you, and let's optimize your hormones, optimize your eating, have that wonderful side effect of weight loss, which your executive client, you just shared it with us. And that's the whole, if I may sidetrack, that's the whole RecoverMe process with weight loss is fix everything else, help you deal with your stressors, both body and mind, and weight loss ensues. You don't have to purposely cut your calories and exercise like crazy, because that actually causes more problems, as we know. We'll discuss that later.
Well, we talked about this with this corporate executive, that his focus was not losing weight. His focus had changed to, I'm going to protect my mind. And as he did these items to protect his mind, it kind of took his mind off of the need to exercise really hard and cut your calories and all the goofy things that we do, focused on a weight loss system. And as a natural result, it came off, and it wasn't his focus. And so I think it was easier for him.
Mm-hmm.
So, but I want to go back to something that you said earlier, just about when this cognoscopy perspective, we have become so specialized in our society that we go to a cardiologist and they look at the heart, right? That cardiologist says, oh, I've got to protect your heart. And so if I protect your heart, get this cholesterol down super low, then it's going to negatively affect our brains and our hormones and our total health, right? And we go to a kidney specialist, and I mean, thank goodness we have them. My son had a kidney transplant in March of this year, and so I'm deeply grateful for the expertise of the nephrology circuit. But if all we focus on is what's happening in the kidney, we might miss the whole person.
Mm-hmm.
And so I have learned that when we focus on the brain, there's a trickle effect, that the kidneys and the heart get healthier because of the interventions that we're doing for the brain. And I'm not necessarily that translates both ways, because sometimes in the cardiology world, our intervention is so specific to the heart, speaking of statins, that it could negatively impact our brain. So the point of getting a cognoscopy is now you have a shepherd who's going to focus on the squash. Mm-hmm. And everyone has been so focused on every other organ from the thyroid down that we haven't focused on the squash. And now bringing people back to the cognoscopy likely will drive success in other body systems.
Oh, I could not agree more. That's why it's at the top. It's at the top. Everything trickles down.
I'm the expert of that.
Yeah, you've heard me say, and it was actually just a post on Facebook. The duty of the neck down is to keep the neck up alive.
Yeah.
And so if you treat that neck up, the neck down responds positively.
Yeah.
And that's so powerful. So we got to wrap it up here, but let me ask you just one more question, because you know it's a passion of mine. You really know it's a passion of mine. It's actually part of the reason we first met 15 plus years ago. Is what's the role of diet in your brain health?
Oh my goodness, Dr. Willey, it is the governor. It is the absolute governor. And instead of maybe answering, the answer is it's the governor of brain health. But oftentimes we talk about what we need to do, and I'm going to talk about what we should just be careful about. If you just think of the traditional American diet, or some people call it the standard American diet, it's that we quickly wake up in the morning and we don't have time to make a meal, and so we just grab something out of the pantry, and that's usually been processed, and it's just a processed food. Not a dig on all the processed food manufacturers out there, but it's not the same as eating a scrambled egg or having something fresh like an apple, right? And then we run by the gas station and we pick up a cup of coffee or an energy drink or a soda pop because we didn't sleep good. And so we're artificially trying to stimulate our body to wake up and get going. And then at lunchtime, we have meetings with clients, and we stop by a famous restaurant or a fancy restaurant, and we have a big meal at lunchtime. And then we need more caffeine at 2 o'clock in the afternoon because we're completely wasted from that meal that just sank like a bomb, blew up in our belly, right? After we've gone to the bathroom 3 times because our bowels couldn't tolerate what was in that meal. And then at dinner time, we're running a little bit late. We've got to pick the kids up from soccer practice. So we stop by and pick up a pizza or some quick fast food, and we get home and gosh, we've just got to decompress. So give me a Coke and some potato chips to sit in front of the TV to watch the next basketball game because I'm exhausted. And then we repeat this over and over. So when you ask me, what's the role of diet in cognitive health? There's no wonder that that cycle that is so prevalent in our society has made Alzheimer's disease the third leading cause of death. And it is projected to be the number one cause of death in the short future. It will surpass cardiovascular disease and cancer. And so how important is diet? Well, if we live that cycle, you are just taking out a guaranteed insurance policy that you're going to get Alzheimer's disease.
Mm-hmm.
Okay? If you want to avoid that, you've got to get rid of that cycle, and we've got to somehow get back to cooking in our kitchens and preparing our own meals and eating things that are fresh and alive and whole and organic and pure and non-processed and loaded with antioxidants and vitamins and minerals, instead of being fortified because we strip them all of those things. And then on the package, we say, oh, by the way, we fortified this with vitamin D and calcium because we want it to be healthier.
What a scam. Don't get me started on that one. Oh, you nailed it, Randy. Thank you so much for telling me that, because that's exactly where I wanted to head with this. Alzheimer's will be the leading cause of death in our country very soon.
You know, it's already the leading cause of death in England.
Wow.
Right?
Look at that. Oh, it's those crumpets at 4 every day those guys eat. No, just kidding. Yes, it is. It just has to be known. We have to start now. I don't care if you're listening to this podcast and you're 19. Start thinking of your brain health now.
Yeah. And who would have known that coffee shops would become publicly traded companies and $1 billion industry? I saw a patient just last week that I said, well, tell me about how you're eating. And she says, oh, well, I love to come to Pocatello and see you because you have a famous coffee shop here, and I always get a caramel macchiato. And so we talked about that she's rewarding herself with something that, like, she's coming to see me to improve her brain health. And part of her celebration to come to the office visit is to celebrate with something that may not help her reach her cognitive goals, right? And so it's so pervasive. You almost have to make a conscious effort to see the world through a different set of eyes. And I don't want to go off because I'll get on a soapbox and it doesn't seem very fun. But the point is, Dr. Willey, you're doing a fantastic work in your RecoverMe and your Obtainable book to talk about how the way that we live predicts the way that we feel. And if we make different choices in our lifestyle, we're just going to feel so different. So congratulations, you're doing awesome work.
Oh, well, thank you. And you too, my friend. What you're doing is it's going to mushroom so big. We got every nurse practitioner and doctor out there listening. Randy needs help real soon here. Send your resume.
Join the forces and let's change the way that people think. So.
Oh, it's incredible. Well, thank you so much, my friend. We went a little long on this podcast, but I think the information's so worth it. I'm going to have you back again because this is so fun. And maybe we can do one on individual. Maybe let's just talk about the roles of heavy metal and toxins in Alzheimer's maybe next time.
Maybe the other thing we can do is I have examples of lab tests that I've done. So I can show you a PowerPoint presentation that says, here's 10 people and everyone's homocysteine levels, and here's their CRP levels, and here's their heavy metals. And you can see that when everyone comes, everyone's a little bit different. So it's not so easy as you don't ever do the same thing for everyone. You really have to look at multiple parameters and adjust for where that person's at. And I've got a nice presentation that I've given at lectures that maybe would be a fun discussion to have.
Oh, I would love it. I think our audience will love it too. And with that, you summed up the RecoverMe medicine. We meet you where you're at. Mm-hmm. And I joke, I'm not supposed to end a sentence with a preposition, but we meet you where you are. And because we can't control all your stressors or what you've been through in the past, but we can certainly help your mind and body heal of them. So with the one goal in mind, quality of life. that's what we're after with RecoverMe medicine. So Randy, thank you so much. Listeners, again, go to my website, drwilley.com/free for all sorts of free stuff. We'll be putting up there in a few weeks, we'll be putting up some books and some DVDs for free. They won't be up very long, so be sure to check in often. And until next time, RecoverMe medicine, Randy, Vawdrey, thank you so much. Have a wonderful rest of your day.
Thank you for joining Warren on the Recover Me podcast with Warren Willey, your guide to living a naturally healthier, happier life. If you enjoyed this episode, be sure to subscribe to this podcast on Apple Podcasts, Stitcher Radio, Google Play, or wherever you find your best podcasts. To connect with Warren and the community, learn more about naturally healthy living, and claim a free resource to improve your health right away, visit drwilley.com. You'll find all of Dr. Willey's resources there, including best-selling books like Better Than Steroids, The Z Diet, What Does Your Doctor Look Like Naked? And his latest book, Obtainable, Enjoy the Body and Energy You've Always Wanted, Beyond Diet and Exercise. That's drwilley.com, drwilley.com. And until next time with Warren, get fit, be healthy, live life.